Welcome back to the program. Many thanks for staying with us on Daybreak. Now, the effects of the coronavirus pandemic on the mental health of people can only be truly gauged in 2021. 2020 was a stressful year that came with its own challenges and focused especially on the physical aspect or the physical impact of COVID-19 on the body. But now that we're into 2021 and a lot of analysis and research can be done, it's time to look at what effect COVID-19 and of course the stress that came with a lockdown, reduced incomes, unemployment and so forth would have had on the mental state of people, especially Kenyans. And some research from Infotrack that was released, I think, towards the end or mid last year showed that 81% of the population then felt anxious and stressed about what was happening. The research showed that 61% of Kenyans felt lonely at that point during the lockdown. 52% felt helpless, not sure whether they'll get sick, not sure whether they'll still have their jobs and so forth. And 33% felt angry. These are among some of the emotions that came out in that research. What's it been like for you? What has COVID-19 and the impact that came with it had on your mental health? Please share with us. 22422 is the SMS line, and the hashtag is Daybreak. Joining me for that discussion, joining me remotely is Sylvia Kasanga, who's a nominated senator. Thank you for your time, Senator.
Thank you so much, Wahiga, and Happy New Year. It's good to
Happy
be on
New
the
Year
platform.
Happy New Year to you too on this 22nd day of January. Here in studio we have Trufena Wakava, better known as Auntie Trufena, a counseling psychologist. Thank you for making time.
Thank you.
We're also expecting Daddy Owen, a gospel musician, to join us, and also Dr. Penny Njoroge. I'll bring them in as soon as we have them on a line. But Sylvia, let me start with you, because you had a bill, or you have a bill, that is supposed to address mental health and help plug in sort of the gaps that have been there in the country, because you know that the focus hasn't really been on mental health in this country. So I want to understand from you, first of all, just briefly explain to us what the bill is all about and what is its status at this moment.
All right, Wahiga, thank you so much. The bill is called the Mental Health Amendment Bill 2018, because we started that work back in 2018. And the essence of the bill actually was to align mental health with the general health care, so that we can have mental health interventions right from level 1 all the way to the highest level at Madare. Secondly, it was to align the bill with the constitutional dispensation, where we have the national government as well as the county governments. We were amending a bill that was as old as 1989 bill that had not been repealed or amended or brought up to speed with the state of the nation, the state of the new constitution, as well as the modern times that we are. Over and above that, we're looking at the rights of people living with mental illnesses. As you know, we have a lot of issues around that issue. And of course, we are looking at expanding the field for understanding mental health, so that it can be approached from a more multi-sectoral approach through education, through fighting stigma, as well as incorporating all the other stakeholders on board, as well as recognizing that we need more practitioners, not just the psychiatrists, but the psychologists and the nurses as well, who deal with mental health. And specifically, and more to heart for me, is the community-based health workers who are dealing with mental health. Because now mental health has to be approached from a focus of community, from the household, as opposed to a top-bottom approach. We have to look at it from a bottom-up approach, and look back into where we used to be as a society, where the family unit and the society is part and parcel of dealing with issues of mental health. And as well as also expanding the understanding of mental health, that it's not just the schizophrenia or bipolar extreme mental health conditions that we see around ourselves, but as well as the common everyday issues that we have to deal with, like anxiety, stress, depression, which we have seen a serious increase during these days of COVID. All that encompasses mental health, and the bill seeks to make sure that all Kenyans get the best possible healthcare and approach towards mental illness.
Senator, all that you've explained to us is well and good, but without funding to back those proposals, we're not going to get anywhere. What has your research revealed about, over the last 2 to 3 years, how much of Kenya's budget has gone into mental health? Would you have any figures off the top of your head? How well or badly are we doing?
There's a very big gap. There's a big gap when it comes to funding. There's a big gap when it comes to the administrative approach towards mental health. there has been absolutely no focus. And I'll tell you, Wahiga, and the viewers here today, that, you know, through the Mental Health Amendment Bill, we brought the conversation, myself and the stakeholders who I found working in that space, we brought this conversation to a national level. And, you know, we raised the voices on that because the approach to it from the government's point of view, the administrative point of view, definitely was lacking, and there was a very big gap when it comes to that. Funding is I can't even speak of it. I mean, it's terrible. We are not even at 0.1% of the health budget that goes to mental health. Other jurisdictions will have as high as 5% of the health budget going specifically to deal with mental health issues. So we have a long way to go. And yes, we have made enough noise to the point where the president, of course, spoke of depression, and went ahead and gazetted the task force that went ahead and collected views that was headed by Dr. Njenga. And that was a good step, because from the task force report, we could see the gaps. It was now very clear, you know, with the gaps. But I said this on another platform the other day, that since the president spoke of this issue, and since the task force report was published, there still has not been any serious approach or intervention from the national level, and especially to do with funding. And especially at a time of COVID, when it is obviously clear at all levels of government that we definitely have, you know, a serious health emergency at our hands. So the gap is real, and it's big.
Okay, very interesting point there, because I saw a report that said mental health gets just 0.01%. We can talk about that a bit later on, but here with me in studio is Trufena Wakava, also known as Auntie Trufena, a counseling psychologist. And I'm sure you want to respond to what the senator has said, but also let's talk about the perception towards mental health. One, how Kenyan society, according to a study, has viewed mental health is denial. There's no problem with mental health. It's not an issue in our family. Silence. Even if it happens, we don't talk about it publicly. Or stigmatization, terms like uamechizi, for example. I mean, I'm just trying to use examples to really get to the heart of it. Other ways in which it's viewed is it's a Western issue. It's not our problem here in Africa or in Kenya. And finally, it's a middle-class issue. Hiyo kitu inafanyika kwa watoto wa dosi. What do you see in your daily job as a counseling psychologist? Are those terms familiar to you as you try and help people with mental health challenges?
Yeah, thank you for this chance. Actually, that is the reality on the ground, that people have a very wrong perception of anyone with mental health. There is also another very, very local term that they use. If they see a person with mental health, they normally say, bagi ni baya. It's like that person has smoked weed.
Oh, bangi ni baya.
Bangi ni baya.
Oh, my goodness.
Bagi si boga, you know, all that. And when that person feels that, one, he feels rejected. That is why these days people with mental illness, they rarely show. Because when they show, they are stigmatized. The most dangerous thing is a person can be having depression, but fake a very good face, fake it to the end because of the judgment they are receiving from the society. And I really don't also blame the society, because they are not all psychologists, but we will realize that our society has not been having that awareness, how to spot, you know, a person going through mental illness, how to help him. Because even the issue of this person is bewitched, leave alone him, because kama amerogwa, we cannot do anything about it. But it has nothing to have been bewitched or anything, but it is already a mental health. Something else that I want to tell you, Wahiga, is that when this person is doing some weird thing, like for example, being angry, being irritated, being sad for a long time, this person is not really him, but he is simply asking for help. If a person has come to you and shouted at you, and also threatened like to slap you, that person, psychologically, he is telling you, please help me, I need your help. But the society does the opposite. Instead, they move away from that person and, you know, they brand him or her, anything. He has smoked this, he has done this, he was bewitched, his family, lineage, and all that. So the society has not embraced people with mental illness. Then the significant others, that is now the people who are close to them, they take them in the wrong places. You will see a person who is just suffering from depression, he has gone to Madhare. And that is a person who has an illness that can be cured in a counseling room. And when he is taken there, he feels like this is not the place. So the condition becomes worse. Others, they are taken to preachers or to clergy. I don't have a problem. I'm also a Christian. But when a person is going through a psychological problem and then he goes through prayers, kind of prayers can help. But I think whatever he is going through is just a smoke. The root cause is other. A psychologist or a psychiatrist will go to the bottom of the issue in a counseling room, and that person will be cured. But you see, for a clergy, he tells him, kuja hapa tukuobe, hii ni pepo. But literally, it's not. It's a disorder that can be cured even without going to the clergy.
And I want you to help us understand, over the last 1 year, 2020, and you may not have I don't know if you've done any scientific research per se, but in terms of anecdotal evidence, what sort of questions were you getting in January? That was before the pandemic hit. What sort of questions were you getting in June, when now people are beginning to acknowledge we really have a problem, COVID is real, and people are losing lives, people are sick, people are losing jobs? And what sort of questions are you getting in December? Now it's the end of the year, it's been 1 year of dealing with the pandemic. How can you say, you know, the requests for counseling support have changed from January to June to 2021 now, where we are?
Roughly, what I can say is that before pandemic, there was not so much requests of people who are going through anxiety. But now during pandemic, and also in a time like now, there has been a lot of anxiety. And most questions that I receive from clients, because I also work in a college, NIBS college, where we are having young people, it's like, what will happen next? You know, that anxiety disorder. People are so anxious because they really do not know when they will come back to job, when things will be back to normal, when they will get their fees to pay their schools and all that. So generally, what I got after COVID or during the COVID up to now, people are going through anxiety disorder. And mostly it is coming because of people they are so uncertain of the future, like what will happen after that. And that is why people are going through acute depression because of how things are. Now they are blaming on a person. You know, in a psychological word, they are going through delusions. That is having a belief that is not true. You know, you blame a person for what you are going through, and having a belief that that is the person who is harming you. He is out there to kill you. He is out there to finish you. And something tells you, I think I should kill you before. It is a perceived belief that is not really true. And when you are talking to that person who is going through such a condition, they always justify themselves that huyu anataka kuniua. But when you look for an evidence, there isn't, because he is just going through a delusion. And what happens next? Then they tell themselves, before aniue, wacha na mimi ni muue. Another delusion that is so common in our society, especially at such a time, is the issue of he went ahead and bewitched me. Huyu alienda na akaniroga. So what happens is, whatever I'm going through in this life, it is because of somebody action who went kwa mganga na akaniroga. And when you ask that person, when they come and I ask them, what do you have an evidence that he took you to such?
So these are common.
It is a very common, and when you look at the murder trails, the murder trails that are happening in our country, even the people who are doing the confession, they are mentioning that one so much, that these people, they went for kwa mganga, and whatever they are having out of that. It is a delusion, a belief, a fake belief that does not have an evidence. And it comes so strong to a person who has mental illness. Kind of, it settles, and he believes that that is the truth. Somebody has bewitched me. And because of that, I will revenge. And the society should also look out for the signs of a potential murderer, especially now, a person who is going through mental illness.
Okay. And I'll come back to you for those signs, because in case you are at home and you have a friend, a neighbor, even a family member who's been acting in ways that are not normal for their behavior,
yes,
how would you be able to spot that this is an issue that needs to be taken to the next level? Let me bring in the good Senator again, who's still on the line. Senator, I'm sure you've heard what is happening on the ground from our counseling psychologists here in studio. How do we get, as citizens of this country, how do we get the government to take mental health more seriously? How do you get MPs, our MCAs, our governors to take mental health more seriously?
Wahiga, first I have to thank the media stations like yourselves for giving this much time to mental health. That is one big step. One of the advocacy encouragements that I give is that we must constantly talk about it. The more we talk about it, the more we are fighting the stigma that the psychologist is talking about, but the more we are giving pressure to the government to do what needs to be done. And it's not that they don't know what needs to be done, they know what needs to be done. And these conversations help with that kind of approach to put pressure on the government, as well as create the kind of awareness that is required. So I encourage these platforms, I encourage you to continue as media houses having, giving this airtime and turn at prime time, so that we can have these open conversations and remind Kenyans it's okay not to be okay, and there is a solution to the time when you are feeling a bit unwell and when you're self-aware enough to understand at that particular point in time you're not well enough. But besides all that, the reason why we're pushing for legislation, and I was asked this question in another platform, that why is the legislation so important? And I said, when there's a legislation in place, then there is accountability. We can point a finger in a certain direction and ask them, why has this not been done? Why has the funding not been put in place? Why is there no mental health board at county level, for instance, that will begin to roll out whatever policies that have been put together by the national government? Where are the policies to help with the county governments to set up and roll out mental health interventions at the county level, considering that health is a devolved system? Some counties have actually gone ahead of the legislation and put their own policies which they have rolled out. And you can find now psychologists and community-based health workers to do with mental health already on the ground, working with the citizens. But imagine if all this was approached, from a national level, and we have a whole battalion of practitioners now in every, county, then we would now say we are beginning to really deal with the issue. And also, let's not forget the fact that each county may have its own unique issues and challenges towards mental health. The issues that you find in Nyanza region will be different from, say, the issues you find at the coast region. So the approaches have to be such that, each county has to come up with its own sort of local solution. But the overarching body is the national government to give these policies from where they sit. And that is what the legislation envisions. And that is why we needed for this kind of accountability, as well as to introduce a budget line at national level and at county government level. So a lot more needs to be done, but I think the pressure now needs to come from citizens that we must speak about it, we must put the pressure out there so that the government is forced to do this. As you saw, the president spoke about it, and it was because there's more and more and more conversation around these issues, which we are happy. We are happy. I mean, from where we were in 2018 to now, there's a very big difference. These days you can see people speaking about it a little bit more. And I can tell you, Wahiga, I have done a lot of advocacy work with young people. You'll be surprised at how young people at the grassroots level are very active when it comes to issues of mental health and encouraging themselves to speak about it and to talk about it. The youth in the arts fraternity, the musicians and the poets are doing a lot of advocacy work towards helping, their fellow young people to come out and speak out and to seek interventions. So what the government now needs to do is give that infrastructure so that now people can begin to go. And like what the psychologist is saying, we can't just have Mathare as the only institution dealing with mental health. It's unfortunate because it just increases the stigma. And whereas I think it was the president's speech last year when he gave his State of the Nation and said that they're happy that they're going to build a new Mathare. They have already identified the site, and I'm reliably informed that a site has been identified and a budget line has been put aside to build a new Mathare, which is okay because the current one has been neglected. It is okay to do that.
Okay.
But if we are seriously going to fight the stigma, then we must have this infrastructure devolved completely to the village and the home level. That way, then we can begin to have some serious interventions.
Okay, you've raised some interesting points, Senator, part of which I'll interrogate a bit later on. But let me ask Trufena this. How do you know the difference between what is an everyday occurrence of stress and where it now hits depression? Everyday occurrence of maybe occasional bouts of anxiety, which happens to every human being, I want to assume, and what is now sort of long-term anxiety that could be more worrying on someone's mental health. How do you know when a friend, a neighbor, a family member now needs, medical support, not just, you'll be okay? How do you know?
They have prolonged reality or a state of sadness. That person remains sad almost throughout. Then they become angry so quickly such that everything can be a trigger. Anything, it can trigger the anger. The other thing, psychologically, it's called a panic disorder. Sometimes, or panic attacks. When they are going through that, it is so intense that they start sweating. A person can also feel like he's losing breath, short of breath. And then a person can tremble, or they start having chills. At this stage, a member of the society can start saying that that person is sick physically, or refer them to the nearest health clinic. But that is not sickness as in physical. It is a mental sickness. He is simply going through a panic disorder. When it goes worse now, it goes to a state called schizophrenia, whereby now they have hallucinations and delusions. Hallucinations is when a person talks of senses that are not there. For example, a person can be talking of, I'm seeing something, but it is not there. Somebody is calling me, but no one is calling him or her. Those are hallucinations, and sometimes they are so deep that even when you have such a person in your house, you cannot literally sleep, because immediately you try sleeping, that person is there telling you, somebody is calling me. It comes with senses, that is eyes. He can see something that is not there. Hearing, he hears something that is not there. And then whatever I was telling you about delusions. Delusions is believing something that is not there, very strong belief. He can also believe that somebody who is famous is controlling him. The people who are obsessed with like celebrity singers, a person can believe that so-and-so is controlling me. And you as the members of the society, you are not seeing. That is why we normally associate it with bangi, we associate it with being bewitched. But basically, that is a person who is mentally disturbed. A person can also start talking to himself. That is anaenda akijiogelesha every time, every moment. And sometimes they are not even aware. A person also, especially for the beginners, they start something and they are not able to finish. You tell a member of your family, go and clean those utensils. He has started, but the energy to finish is not there. That is how we brand them lazy. But they are not lazy. They are going through an illness mentally that they need help. Then, the other common thing, it happens now to pregnant mothers. That is why you are realizing that people are giving birth to their children and they are killing them. Because it comes after birth, or even during pregnancy. The surroundings, or whatever surrounded her pregnancy, that contributed to this disorder. So she hates her pregnancy, and sometimes she keeps crying throughout the pregnancy. The mother of that victim can simply say, this is a girl who is just going the normal disorder, because she doesn't love her pregnancy. When she gives birth, it doubles. Because all the hatred that she has been having, all the bitterness she has been having during the pregnancy, it is projected to the child. So the child, because is innocent and defenseless, he doesn't know what to do. So that is why that mother cannot literally love the child. So because he is mentally disturbed, he feels that this is what I have. defenseless, but I can project too. So she kills the child. But I would like to say that the members of the society, they should support such a person so that we can really save the life of the mother and the life of the child.
Okay.
If you realize that your daughter is pregnant or your wife is pregnant, but he is going through some, you know, abnormal disorder, it is always good to call for help. Don't say it is the normal pregnancy stress. Yes, it is there, but when it goes to such extent, when you realize that she has a child and she can't literally take care of that child, you should call for help. Don't say no one can hurt her child. We are seeing them in the news, Wahiga.
How do you, and I know we'll be bringing Daddy Owen shortly to join this discussion, and we still have Senator Kasanga on the line. Briefly tell me this. As you speak to me about some of the cases that are brought before you, I wonder about how it affects your own mental health. Talk to me about how mental health experts like yourself stay above the incidents that they deal with. Keep your own mental health in check even as you help others and support others with their mental health.
Yeah, thank you. Yeah, I'm a human being. Before I become a psychologist, I'm also a human being. So what we do, I also go under supervision, you know. And we have a group of other psychologists. So that is where we share. We have WhatsApp groups. We meet regularly. And that is where now we share. We normally don't give the name of a person, but we normally say, I had a client A who had this issue and this issue. So you debrief. When talking about the issues that you encountered in the office, you are debriefing, and somehow you are also healing yourself. And I'm telling you, Ahiga, these issues, they are not easy. A person coming to your office and telling you that I want to kill myself, I feel that I have reached the end. The difference between us, psychologists, and the members of the society is, if you tell any person out there that you want to kill yourself, the first thing is like, why? You know, they get like frightened and all that. Then if you go probably to church and you tell them you want to kill yourself, piga magoti hapa nikuobe. You see that whatever. But when you come to my office and you tell me you want to kill yourself, I will stay just like I am. I won't move. I won't show emotions. But the first question I might ask you, when are you planning to kill yourself? And how are you planning to do it? The issue is not, it's not that I really want to know the mode of your killing of yourself, but my goal is to really open up. Because when you come to disclose such an issue to a person, and that person screams or reacts in a way, then you'll feel like you block. You'll feel like I'm also frightening him, so I should not share. Then the members of the society, especially now when a person goes to social media, and then they just write that I have reached my end, I want to commit suicide. That person, I usually look at the comments, and that the people suggest that go ahead and do it. You know, others, they try to make fun that you are not the only person. Others, they try to say, you know, the common or the biggest percentage, they only take that person, they push him away from them. It is only that sometimes us like psychologists, we try to tell them, to help them that come, we offer help and all that. So we go and then we debrief ourselves, and we get healed, because you cannot bottle up everything.
Okay, thank you so much for that. My goodness, okay, learning a lot today. Daddy Owen, we have you on the line. Good morning, Happy New Year.
Good morning and Happy New Year.
Good, good. The last time we had you on, you spoke about the challenges of 2020, you know, challenges with your business, what you are doing and so forth, and the mental effect it had on you. One of the things we know about men is that, and this is a quote from a mental health advocate, the extensive burden of masculinity, men have been viewed as immune and devoid of feelings or expressing emotions. And this has affected how they deal with mental health. I think I spoke with you, what, a month or two ago about this. I don't know what reactions you got from that show. I don't know whether men reached out to you and said, man, what you spoke about, we are going through as well. What do you now know about men and mental health that you may not have known in the past?
So many people came out and we discussed in depth, and to be very honest, so many of us, we don't believe that, first and foremost, me as the DON, I thought, number one, you're a man of God. What is stress? Number two, I thought, man, you're a superstar. You understand? These things don't affect anyone. You understand? Like you. These things affect people who are going through a lot in life. And number three, I was like, I'm married, I have kids, everything is fine about my life and all that. But after a while, when I analyzed, I did find out that at the end of it all, she has just said, at the end of it all, I'm a human being. I have feelings, I have emotions, and I'm going through this. And for me, it was really hard because everyone I tried to talk to, it had to be a secret because this is the DON who is trying to talk to Dr. Kigabu. This is the DON who is trying to talk to Dr. Begwa. You understand? So it was a process that it really affected me because of my status. And more so being a man. Because every time you try to talk to another man, they tell you, bana, jikaze kimwanaume bana, nini nakusumbua.
Let me ask you this. So then what gives you the courage now to talk about it on TV? What gives you the courage to talk about it with other people? And are you finding relief and release when you do that? Like after the show we did about a month or two ago, what did you feel later on that night when you went to bed, for example?
I really want to thank you guys for that interview because that interview made me realize that so many people are going through it. And everyone was like, if the DON can come out and speak about it, then even here can come out and speak about it. So through and through, I've been working with so many guys, so many people who are married, so many people who are telling me they're married 10 years, 15 years, they're going through a lot, you understand? So I talk to them, I try to talk to them, and I tell them, sometimes these things, just talk to someone. And eventually, this person, I'm not a psychiatrist, I'm not a psychologist, I'm not a counselor, but I've been there, I know how it feels, and just speaking to someone and talking through it is very important. And there are others who I advise them, talk to Dr. Nani, because it's very, very important to do a session, to go for counseling, because number one, the reason why mine stayed for so long is because I had decided I'm not going to do counseling. I was like, I counseling in mambo ya wazungu. See, to Africa, na maisha ngumu yenye, you don't believe in counseling. But eventually, I realized I must go for counseling. So when I did, even right now, I advocate for guys to go for counseling, no matter who you are. Just do it. It's very, very important.
Okay. Oh, Daddy, and thank you for that. I'll come back to you with more questions, but let me bring in Senator Kasanga, who's still on the line with us. Senator, one of the challenges that we also realize is, and Daddy has raised the point, go for counseling, right? But this show is being watched across the country, in the rural areas, in places where the nearest counseling facility might be maybe a couple of tens of, okay, maybe 100 miles or so, kilometers away from where you are and so forth. Let's talk a bit about that, decentralizing mental health so that it is available across the counties, but also let's talk about mental health workers. I read a report that stated that generally medical workers frown upon psychiatry. It's not as prestigious to be called a psychiatrist as it is maybe to be called a doctor of something else. And so many of them will shy away from that, even if it is their passion because of family pressure. Maybe they feel they won't earn enough of a salary. I don't know whether your bill also looks at how to make the mental health sort of part financially, make financial sense for people so that we can get more people coming into it, so that we have more doctors who deal with it, more psychiatrists, so that it's easier for Kenyans across the country to access these services.
Yeah, Wahiga, several things you've raised there. One, when it comes to the approach at the community level, then definitely we need a lot more, say, community-based health workers to do with mental health, and those can form the initial battalion of practitioners who come to intervene at a very early stage on any mental illness that may be occurring at the village level, at the home level. Don't forget that these are the same practitioners at their level, even if it is a low level. They're the ones, again, who can disseminate information and help, encourage Kenyans to come out and speak out, more. That battalion is definitely needed there. When it comes to psychiatrists and psychiatry and the profession of psychiatry, which is at the highest level in the mental health, scale of practitioners, they are the highest. And it has been said severally, you don't need to have 1 million psychiatrists. I think the statistic is one psychiatrist for, say, I think 30,000 or something like that, the World Health Organization standards, or something close to that. So in Kenya, we have about 106 psychiatrists. They're very few. But the question is, do we need to train more psychiatrists, or do we need to approach mental health from that very basic level where you can have interventions like the psychologist today has said. There are some interventions that can be done by a psychologist that do not need a psychiatrist. If a psychologist then is not able to, then it can be escalated to a psychiatrist. And there then comes the question of how does our referral system work? Because that's where now level 1, level 2, level 3, level 4, and up to the highest level of referral then comes into play. And at what level then do the psychiatrists then need to come? I am also reliably informed that even the trade of psychiatry as we know it today is also shifting to a more community-based psychiatry approach. And that's what the other jurisdictions who have advanced in mental health interventions are going towards, a more community-based approach of psychiatry, so that we can now, we can dismantle mental health institutions that cause a lot of stigma and bring it down to the level of a normal healthcare facility where somebody can just walk in and get a full healthcare spectrum. When it comes to access in terms of finance, one of our major issues in the bill is to push for financial accessibility through NHIF. The universal healthcare program that is being rolled out by the national government needed to have encompassed mental health, and this issue had been left out. I have raised questions even to the CEO of NHIF. Is mental health being covered adequately, such that Kenyans just can receive as much help as possible through NHIF, counseling, rehabilitation, access to medication, which can be very expensive, and the psychologist will tell you, medication for mental health is very expensive. So we need to continue pushing for this and putting that much stress. And Wahiga, you had asked me another question that I think I didn't answer. You had asked me how far is this bill? And I'll tell you that although Senate passed the bill, early 2019, we passed the bill. It's very unfortunate that the bill went to National Assembly and was considered a money bill and was caught in that battle between Senate and National Assembly. But the task force, Dr. Njenga's task force, has come out clearly and said we need this legislation alongside other legislations. For instance, the decriminalization of suicide is a low-hanging fruit that legislators need to just come together and give some stopgap measures that can give relief to Kenyans as we wait for the overarching bill to come. So this is something we are continuing to push this year. And in fact, this year, we are rolling out with some stakeholders an amplification of legislative voices. We want to get some legislators, educate them on what is mental health, because they also need education. Then over and above that, we roll out a conversation to Kenyans to tell Kenyans, fungua roho, tuongee. You see, like Daddy Owen is saying, there's so much relief in just speaking. It's shocking because even I myself, I have, gained a lot of relief from speaking because I have encountered depression, I have encountered stress, and I've encountered actually what the psychologist was saying, panic attacks. That is something I've gone through. But the more you speak about it, actually it's the first point of, that acceptance is the first point of healing. So we need to speak about this, and we are getting the legislators back on board so that we can push for some interventions from this national level.
Do you think, briefly, do you think COVID-19 and its effects made it easier to get these laws out there, Senator, made it easier for Kenyans to talk more about this? Or do you think COVID-19 made it harder because now all focus was on COVID and everything else was put aside?
Actually, COVID did help us in that conversation. I'll tell you, Wahiga, even as I was the chair of the ad hoc committee on COVID, it was one of the questions that we are constantly checking on. What are the county governments doing when it comes to helping Kenyans with mental health? Is the ministry, the Directorate of Mental Health at the ministry, how much communication are they giving out? What sort of interventions are they rolling out to help Kenyans who are increasingly becoming, affected by mental health? And as well as safe havens. It was our committee that was pushing for these safe havens at the time when the COVID lockdowns were happening, and we were saying people need to be rescued from homes and taken to safe havens, whether it is because of gender-based violence, which has a direct connection to mental health, and we were calling for these safe havens at that time. So yes, it helped with the conversation. In fact, it helped to the point that I now know that the Ministry of Interior is rolling out interventions of mental health for our men and women in uniform, because they have also been most affected over the years. So this has helped with amplifying the conversation.
Okay, and here with me in studio we still have Trufena, also known as Anti-Trufena, a counseling psychologist. Sir Nixon Dugire, a regular, sends in his messages. Kutoka Kindaruma is asking, are there herbal remedies for mental illness?
Herbal.
Yes.
That I am not sure, because anything to do with the medication, it is given from a psychiatrist's office. As psychologists, we do not offer medication.
Okay.
And that is why sometimes we refer, especially a case of schizophrenia, whereby it's now out of hand. We refer them to a psychiatrist's office, as is purely psychologically talking to that person and all that. So anything to do with medication, unless now they go to a psychiatrist's office.
And it's highly unlikely that a psychiatrist will then send you to a herbalist.
Herbalist.
I don't think I've had that yet. So the main difference between a psychologist and a psychiatrist is what? Simplified for us.
A psychiatrist deals so much with mental cases which a psychologist cannot handle. And a psychiatrist, he gives medication. If you go out there and you meet a psychologist giving you medication for your mental health, that's a quack. We do not offer medication. They are given to a psychiatrist. For example, if a person is going through drugs and he is so toxic, now he goes to a psychiatrist office.
Okay.
Then for the members of the society, they need to know when a person should be taken to a mental health center, for example, Madare. And I would also encourage that we have so many centers like that, like now what the center is saying. Then we should always know, as the members of the society, that they are not demons. Having a mental illness, let us not generalize it and we say that these are demons. Because when we call that person demons, and sometimes I normally tell, where I go to seminars, I normally tell, can you try to differentiate between, and then you separate the illness from the victim. You see the individual first as a human being, and then you see a case of sickness. Because even when a person is sick, like for example malaria, we do not say that that person is cursed. We normally say this is a disease. When he will go and he'll get medication, he will get fine. So I would urge the members of the society to separate the victim from the illness, because it's not that they are mad. It's not that they have demons. They are simply calling for your help. Another thing that I would like to say, that even if it affected the COVID-19 impact, it seems like it affected the adults. It also affected the children. And children are also going through it. And the parents should be on the lookout. Don't say that this, my child has become now another thing. He is so disobedient. If you see a child throwing tantrums, if you see a child not listening to you, if you see a child throwing utensils and all that and fighting his sibling, that child is simply telling you, Mom, Dad, I need some help. Do not take me as a disobedient person, but please offer me help. And I would always want to say that do not, because the society also has an issue of kufunika the members of their family who are mentally disturbed. They normally, you know, they don't want even the closest neighbor to know. That's because right. They don't want to be branded that you are Irogwa. I want to say that it is the high time we speak out. Talk about it. It's not that you are exposing that person, but please talk about it. Because when you tell your neighbor, this is what my child is going through, that neighbor can help you. Don't necessarily say it is better when I'm handling it alone. And that is why people are getting killed by the significant others. Because you are killed by your closest person, because in the first place, you feared to talk about it. It is very important even to walk to a counseling office and talk about your child. Talk about your grandchild. I have seen this and this. The other very important thing is that when a person wants to commit such, or when a mental ill person wants to murder, nature has it that at one time they confess to you. You know, in a heated argument, in a heated scenario, that person can just say from anywhere that one time, mimi nitakuua. You should never take that for granted. It is not a slip of the tongue. That is what is in his heart, and that is what is in his mind. So don't say, huyu alishikwa na wazimu, ananiambianga kila siku ataniua.
Confide in someone about those things.
Confide somebody to someone. And then when he tells you about that, it is also very important to separate his illness from himself. Because what happens when a person says, I will do this or this to you, I'll harm you, or I kill myself, that person is branded as a mad person. So what you do, you avoid that person. When you are avoiding him, you are pushing him further, and you are accumulating the hatred that he has for you. Okay. So instead, you are supposed to counterattack it with a lot of love, and at least you talk. Then the other thing, don't overreact. Even when a person tells you that I want to kill myself, don't overreact. Don't start shouting. Don't, but go to that person and try to speak out. If it is beyond you, refer that person. It is okay to seek help, even from his closest relatives and all that, but don't keep quiet.
Okay. Wow, my goodness, a very important discussion that we're having this morning. I want us to take a break and take time to think about what each of my panelists have shared. And if you're in a situation where some of this advice is relevant to where you are, please take the appropriate steps, seek professional help, open up to a family member about what's happening as well. We still have on the line Daddy Owen, a gospel musician who's opened up about his mental health struggle in 2020. Sylvia Kasanga, nominated senator. She has a bill that's still making its way through the National Assembly, but one that would hopefully change the country for the better. And Auntie Tufena, a counseling psychologist. That discussion continues on the other side of the break. You're watching Daybreak. Stay with us. Remember, you can text in 22422 is our SMS line. And the hashtag is Daybreak on social media. We'll be right back. Welcome back. During the break, we were actually discussing, does everyone need support? And that's one of the questions that will be coming up. Whether you feel you're okay, all is well in your life or not, I've read in some books that every person needs a session just to sit down and open up about what they're going through. Today we're talking about mental health and stress, and we've been hearing different thoughts on this, both from a legislative perspective, personal experiences. And I want to bring in Daddy Owen, who's still on the phone, who's still live rather, with us. Daddy Owen, 2 months ago we spoke about mental health, the impact of COVID-19 on income and how it then affected one's perception about themselves and so forth. And you've shared how you got such good feedback after that. But in the midst of it all, I'm sure you also got some negative feedback. You got people who said, why did you go to TV to talk about that? Or, you know, jikaze ki, you know, ki mwanaume and things like that. Or those are things we don't talk about. There might be men out there who are thinking about talking to their loved ones, their girlfriends, their fiancés, even their wives about their mental health struggles, and they think they will get the response you got, or maybe not. What's your advice to them? And maybe share, because not everyone, mental health is still a new topic and not everyone understands it. How do you prepare men for when they open up, if they get negative feedback, how would they deal with it?
I think the first reaction I got, so many people felt like I'm a weak man. So others started calling me a weak man. Others started saying that there are such things you can't discuss on air. People will look at you differently and all that. But for me, I was like, you see, the most important thing I discovered when I was going through depression, what I was lacking and what I was looking for is peace. The moment you have peace, you come from a point of, you can discuss anything with anyone with a lot of confidence because you know you have peace. But when you don't have peace, you can't sleep, you can't eat, you can't think straight, you can't be stable even in your marriage, you can't be stable even in anything that you're doing, even your business and all that. Without peace, even in office, you can't function. So that's the most important thing that I was looking for. I was looking for peace. I was looking to talk to anyone who can understand what I'm going through, what is happening to me. And it reached a point I became so desperate, you understand? And that's the worst thing. When you become so desperate, now is when people start looking at you as a weak person. You start crying, you start talking about other thoughts that I've had the psychologist speaking about here. These thoughts, I had these voices in my head, and they were not good thoughts, you understand? And I feel like I need to talk to Wahiga and tell Wahiga, something is happening and I feel like I'm not important in this world anymore, you understand? Those are the things that you need to share, you need to talk to someone about, because at that point, I used to wake up in the morning, I don't feel like doing anything. And I started looking at myself as, I'm not important anymore. I'm not valuable anymore, from my family to the public in general. So these are the things that make people start looking at themselves and feel like maybe you're weak and all that. But I discovered, the moment I started talking about it, I became stronger. And that is the moment my healing process started, and that's how I came out of it. And I can urge you and assure you, as a man out there, speak about it, talk to someone. Trust me, it worked for me. If it worked for me, it can work for you, and it will work for you.
Wow. You know what, Daddy, even as you speak, dealing with mental health in many, okay, it's different from dealing with a physical condition, right, like a flu. And we know that when it gets cold, there are things you start doing. You immediately start wearing a sweater, you ramp up your vitamin C and so forth. So there are things, you come up with a coping mechanism because you've dealt with this in the past. What is now your new coping mechanism? What is it that Daddy Owen now does differently that he knows is the healthy way to deal with any stress that may come in his life?
Number one, I discovered that I used to keep everything within me. I was not opening up to other friends. I used to categorize all my friends, and I say I can talk to this thing. I talk about this to this kind of friend, and this about this kind of friend. But number one, I discovered, I need to know that there are things I just need to let out. I just need to let out. As much as my friend, I just need a session with you. Come, let's have coffee. And in that coffee session, I let out whatever I feel is in my heart. And from there, from that moment, I discovered there are people who understand me and others who will not understand me. But venting really helped me. And then exercising. I discovered I need to exercise a lot. Most of the time, when I'm out there exercising, it's really helped me. And then listening to positive stuff. Because the moment you enter into depression, the first thing that you start listening to is more negative than positive. Or even if there's anything positive, you just convert it to negative. You understand? So I started talking to myself and listening to positive stuff. Like for me, I believe in God, so I listen to more preaching. And preaching that talks about positivity, you understand? Those are things I discovered I need to do. And then once in a while, because I'm in a position whereby I can afford to get a psychiatrist or psychologist to have a session with them, a counselor to have a session with them, I do, which is very important. Even if I feel I'm out of it, I still do it. Because for me, that is my moment whereby I feel like I need to go out there and just vent. I'm always excited for my counseling session because I know I'm just going to vent. I'm not going to say anything important. I'm not going to say anything that I feel like is affecting me right now. I'm just going to talk and talk and talk. So for me, those three things have really helped me. And of course, there are other things like dieting and all these things. But the most important is make sure that, number one, you find peace within yourself, that you come from a position of peace. And from there, your foundation is so firm to a level whereby now you start thinking straight, and that's the healing process. And accepting part that you're going through mental problem and stress.
My goodness, Daddy Owen, thank you so much for opening up on a national platform like this one. You don't know how many men you may be encouraging, and women out there who are going through what you have gone through and who don't know what to do, don't know who to talk to. And you're right, in many ways you can find that you have no one to turn to at a time like that. For you, Senator, coming back to you, I'm sure you did a lot of research to come up with your bill. I'm sure you looked at what's happening in other countries. Sometimes we have a tendency to compare ourselves with the West, which has had, they've been able to manage their affairs for a lot longer than most African countries. I don't know that you have any research from any African countries that are handling mental health better than we are. And if not, what's happening in the West that we can, plan to emulate even as we catch up with them? Help us understand where you got your research from.
Yes, a lot of our research was, of course, based on Europe, but we do know that South Africa is doing a very good job when it comes to mental health interventions and having devolved their units down to a village level, and as well as Rwanda. Rwanda is doing very well, and mostly because of the post-genocide interventions, because you can imagine the post-traumatic stress that citizens had to deal with. So they have a very good network, again, which is devolved to the community level, which is something we borrow from. And largely, I keep saying when I speak on this issue and the backdrop of it, the pre-colonial social structures that we had and we have lost in this post-colonial era is where we find ourselves having a challenge. We have to catch up with an already evolved world that has been brought upon to us without the social structures that we were used to, that were helping with such like interventions. Don't forget that the expanded family setup that we had played a very key role in how we handle our social pressures. And that has now broken off. We are now into a nuclear unit that is having to deal with all the social pressures as you can imagine. And this is where some of the rain starts beating us as a community, as a Kenyan community. And whereas we have been bombarded by the West, now we must look back to them. How did they overcome these issues? Because we have to overcome them in such a short period. Our country is not even 60 years old. The post-colonial Kenya is not 60 years old. It's a very young nation. These other nations are hundreds and centuries old of dealing with issues and overcoming them over time. So we have to look back to them and sort of leap forward and see whatever interventions that are working for them now are the sort of interventions that we need now. And I'll say that in Europe, you will find that mental health institutions have completely been collapsed, and things have gone down to the community level. And that is the new approach. That is the best approach towards psychiatry and towards mental health interventions. Destigmatization must be done. And in fact, when we had this conversation with Dr. Njenga some time back, he reminded us that when we were dealing with HIV in this country, in the 90s, late 80s and 90s, that level of intervention that we saw happening with HIV is the same sort of intervention we need to do here in Kenya today, because we really do have a public health crisis. We must roll out the fight against stigma towards mental health the same way we did for HIV. We have to be able to wake up, like Daddy Owen is saying, just casually and say, today I have a date with my psychologist, and it is okay. It should not look like the minute you mention psychologist, now you are branded and you are, isolated. We have to reach that place, and these structures are necessary, and they require the goodwill of the government at national level and at county level for us to be able now to move forward. And we must leapfrog from where we are now to what the modern societies are doing. And it is good to know that we have an African country that has structures that actually work, like Rwanda. And we've gone there, I've seen it myself, because I've spoken on mental health at the regional level. We've talked about this. And whereas the bill that we have proposed is a very comprehensive bill, actually something that our neighbors are waiting to see how we shall roll it out, because they want to borrow from us. So you can say, yes, we may be a little ahead when it comes to that. But when it comes to the actual doing, Rwanda, Kigali has done a lot better than we have. And in fact, theirs has gone as far as having, you know, even when it comes to like the safe havens that I was talking about, they even have call lines and things like that, and, you know, outreach programs where they can go to an actual home and, you know, pick out anyone who's affected and help reintegrating back somebody who has been to rehabilitation and speak to the entire village. And some of the other interventions we can say that the government now can escalate that can help with the mental health interventions are things like the Nyumba Kumi initiative. You know, essentially the Nyumba Kumi initiative, if you think about it, is bringing back that communal living that we no longer have as a society. We are saying, can you be aware of your neighbor who is living right next to you? Know a little bit about them. When there is a stress, you know, call from that home, go there and reach out. That's what Nyumba Kumi essentially is doing. And these, again, are the social structures that we have lost over the years. If we can bring them back, then we can begin also to deal with this mental health crisis that we are having right here, right now. Ohiga.
Okay, thank you for that. I still have Auntie Trufena, a counseling psychologist, here with us in studio. In workplaces abroad, we have seen scenarios where they have a counseling psychologist at the workplace, and everyone is advised to do a session once or twice a month or something of the sort. Realistically, would you say that everyone should get some counseling, and how often, if it is something that people can afford? Sort of a guideline or a standard, the way they tell you every year get a physical body checkup.
Absolutely, it should happen because, one, it should, mental illness is just an illness like any other. That is one. Secondly, whenever we are going, a person is going through mental illness, remember it doesn't start after showing the signs. The signs are just a smoke, you know. It has the fire out there. For example, when a person is having a lot of anger, shouting, abusing and all that, that is just a smoke we see. But now there is fire. So I would urge everyone, every time, to go for a psychological checkup. The problem is, if Wahiga, you tell another person, not really me as a psychologist, you tell another person, if you tell a person, I'm going for a medical checkup, people will say, oh, that's fine, it's okay, that's very healthy. Wait until you tell a person, I'm going for a psychological checkup. They will ask you, kwani uko na mashida aje wewe? You see, so the society should embrace. I want to give a very good example of where I work part-time, that is in Nibs College. Our staff usually goes through that psychological help, and we always encourage them. You are not coming to the psychologist because you are having a problem. You are coming because you are a human being. Our new students, the same. We normally tell them, you didn't come here because you are a mad person, but you came here because it is necessary. I, myself, as a psychologist, I go for a psychological checkup to my supervisor. That is now my psychologist. And even her, she has a psychologist. It's a ladder. It is supposed to be a ladder such that we are holistic in all ways. The other thing that I would like to mention is, just as Dr. Owen says, that it is not a must that you must be okay. And it is okay not to be okay. You are supposed to feel that I am not mentally fit, then I should do this, and speak up. You know, when you have a problem, Wahiga, and you go and talk it to someone, even if that someone has not helped you, just by talking, you have gone through a psychological step. You have gone through a psychological healing. There is power in speaking.